Our responsibility as nurses is to interact respectfully with all of our clients, regardless of their background culturally, their background racially, ethnically, religiously, politically, anything like that. But we have part of that sensitivity to our patients is a careful assessment that includes an awareness of factors in their lives that could serve as barriers to them receiving adequate health care. And so people who in the United States for whom English is not their first language, they may have lower health literacy, and this can be a tremendous barrier to receiving health care, to understanding the health care that they receive. Poverty and limited access can reduce potentially the quantity and the quality of the health care that they receive, simply not being able to afford it or not being able to get to it because of lack of transportation funds and so on. Um, uh, some people are very proud and unwilling to accept care, say at free clinics, because they want to pay their own way. They are very proud about accepting what they would call handouts, and this can be a barrier, despite the fact that there are organizations that underwrite the free clinics with the very intention of helping people who have limited health care means or resources. And then, as mentioned in another video, our beliefs, our values about health and health care and what are acceptable practices for maintaining our health or for taking care of ourselves with our ill may potentially stand in the way of receiving health care. Medications may be a good thing to one cultural group and may be seen as a crutch or only used by weak people from another culture. Certainly, as I mentioned in another video, both there for many people there's an intersection between culture and religion, and religious beliefs may affect the way the patient interacts with the healthcare system. Maybe simply don't believe in going to doctors. They believe in letting God take care of them, healing, a divine healing, or going to a shaman because there are certain spells and rituals that can be done. They believe in order to restore their health, take care of the evil spirits, so on and so forth. There are certain religious groups who don't believe in receiving blood and blood products, for example. Jehovah's Witnesses is a group that is in that category. And then, of course, beliefs about the way, about the extended family and the social structure and family structure can affect how healthcare decisions in an extended family are made. There are families where and cultures where they're very patriarchal, where the males, the men of the family, make all the decisions, even for healthcare for women and children. There are cultures where a clan lives more or less very closely together, and they may share resources. And so, whether or not healthcare is paid for is a decision by the clan, not by the family or by the individual. And so, we have to be very aware of those particular uniquenesses of our patients so we understand what they believe about the care that we're offering, what they're likely to receive, and how we can help them get the maximum amount of health care. Your textbook talks about some of the things we're going to assess then. Based on what I just said, we want to know what language our patients speak and if we need to arrange for an interpreter. Are there any other communication practices that they use? Are they at all are they literate? Can they read? Do they use electronic communication? Do they have email? Do they use the internet? Lots and lots of things that some people believe about acceptable communication practices. What are their practices? Do they have dietary practices that they believe affect their health? Seventh-day Adventists have some fairly clear-cut dietary rules and regulations about smoking, drinking, and food consumption. What medicines have people used in the past? What are they using currently, including herbal treatments, supplements, folk remedies, home remedies, and over-the-counter drugs, and then any other treatments that that they're willing to receive or that they're unwilling to receive. For example, blood transfusions not being okay for some groups. Um, I've mentioned already that some people may believe different things about health and about illness. Some people believe that illness is a visitation from evil spirits or the devil, and so they are going to look to, as I said, religious and maybe rituals and practices to get rid of those spirits, while others see illness as a physical thing, and and people may be more or less responsive to medical treatment from the traditional Western medical practitioners. What kind of support does a patient have when he or she is ill from their cultural community? Are they part of a supportive network of people in a church or of an extended family, or a cultural group? And what does that mean when they're ill? Are they going to be able to receive help from others if they need it in order to recover, to get well? And then do they have any particular beliefs and practices about diet that they think affect their health and that maybe a registered dietitian would be somewhat concerned about, depending upon their diagnosis? For example, someone with heart failure who typically is going to have a sodium restricted diet, if they are from a cultural or ethnic group where there's just a lot of salty food that's being used, that's going to be a conversation that the dietitian will have with the patient, and the nurse will support this to try to make sure that the patient understands what the implications are for their disease of continuing to practice their dietary habits just as they have been practicing them in the past. So much to think about, and yet thinking about it is a way that we can offer respect to our clients of a wide range of cultural backgrounds.